Dr. Hanisyam. Today I'm going to ask Doctor a few questions, and hopefully it will shed a bit of light in terms of the process that we're doing. Thanks so much for joining us this morning, Doctor.
Yeah, thank you for having me, Dylan.
Great. Okay. How does the process of obtaining an online prescription through gethealthcare.ie work, and what types of medications can be prescribed?
Yeah. So thank you for the questions. Basically, when we receive the prescription, and we see what kind of medication it is, what's the durations, and then how many tablets the patient wants, the dosage. We have to look into it, and the reason. The most important thing is the reason why the patient wants it. So we do not want to give to if the patient doesn't want it, so we do not want to give that. So we have to specific diseases or problem that the patient has that we can prescribe. For example, we have acne problem, we have consumptive pain. So that's the most common. Other medication, sometimes we have to do online consultations so that we can make sure why the reason the patient wants it.
What are the benefits?
Sorry, one thing, the pharmacy. You need to know which pharmacy the patient wants us to send to.
Very important. Very important. Yeah.
Very important.
What are the benefits of using an online service like Get Healthcare for prescriptions compared to visiting a traditional GP?
As usual. So GP, you need to make appointments. You just send the applications, and if we need to, we will have online GP consultations. If it's just simple medication, repeat prescription, we just straight away do the prescription and then to send to their own pharmacy.
Okay. So convenience, accessibility,
and fast.
And price cheaper.
Cheaper price and fast.
Faster.
Okay.
Yeah. What safeguards are in place to ensure prescriptions issued through gethealthcare.ie are safe and appropriate for patients?
Yeah, that's why we have to get into each medication that the patient wants. The patient apply. So if the patient apply that doesn't and need to, then we inform them that this patient the patient doesn't need it, and then we don't prescribe benzodiazepine. We don't prescribe sleeping tablets to the patient, and also some medication that codeine, because certain area that the patient there's an increased number of addicted to certain medication, codeine especially. So we don't prescribe that.
Okay. Can you share some common mistakes patients make when requesting prescriptions, and how gethealthcare.ie helps to avoid them?
There's no pharmacy, so there's always we have to ask for a pharmacy.
Yeah.
Second is sometimes there's the dosage they want us to prescribe. Yeah. So how many milligrams? How many? Is it 10? Is it 11? Or is it 15? Something like that. So, and then the durations. And then, of course, sometimes they don't put in why they need the medication.
Okay.
Yeah.
Okay. Why is the most important one? Okay. So, how does gethealthcare.ie handle prescriptions from minors or non-Irish residents, and what are the limitations?
Yeah. So we have actually receive a lot of non-Irish. No, we don't receive much non-Irish. We only receive the Irish prescriptions. So the patient make sure that the patient must be here.
Okay.
In Ireland.
Yeah.
When we send. The patient doesn't matter whether the patient is non-Irish, non-Irish passport, which is not they are foreigners. There's no problem. Immigrants, there's no problem.
Yeah.
So when they are in Ireland, you send straight to the pharmacy here in Ireland.
Okay.
So basically, anyone in Ireland can use our portal. Anyone, as long as they are here in Ireland.
And what about minors?
Minors, yes, of course, we can't give to minors as long as we must have some. We must be prescribed by parents or their guardians.
What are the most common conditions which patients seek prescriptions through Get Healthcare? How quickly can they expect to get them? So I think you spoke about acne, and you spoke about what was the other one? Contraception.
Yeah. The two most common application. Yeah, because that's what they want. They repeat prescription basically. Yeah. Because the reason is because they can't get they're difficult to get appointment with their own GP, so they're easy to get from us. We just review within 12 hours, maybe less than that, 6 hours. You can get straight away to the pharmacy.
Okay, good. So that answers the second question: is how quickly can they expect to receive them? So within 6 hours, best case scenario.
Yeah.
Okay. How does gethealthcare.ie ensure prescriptions are cost effective, and what should patients know about additional pharmacy costs?
Oh yes, they should know that, because we only provide prescription. That the patient needs to know that they have to buy their own medications. So how much is the medication? It depends on which pharmacy. It depends on different on each pharmacy. We do not know how much they sell it. So that's what they need to know. Their own GP, how much they going to cost. Their own pharmacy, how much they're going to cost. So, but our portal is cheap, affordable, and fast.
Okay, so we can't control the pricing from the pharmacy, but people can shop around, and there are online pharmacies as well.
There's a lot of pharmacy, especially their own places. There must be 1 or 2 or 3 pharmacy. It depends on where they are from, but they can shop around how much they cost.
Okay, very good. Thanks so much for your time, and we'll speak next week. I appreciate that.